Welcome, everyone. Thank you for joining us today amidst all else. Happy Earth Day. I'm Sofia Gruskin, and I direct the USC Institute on Inequalities and Global Health. And I want to start out by saying something about Earth Day, and I'm not trying to overstate the leadership role that California plays, but I'm not sure that if people know the history. Jonathan reminded me of something I'd completely forgotten, which is that Earth Day was born here in Southern California in 1969 when there was an oil spill off the coast of Santa Barbara, and it mobilized activists to push for environmental regulation, but also to create education and awareness. So the first Earth Day was on April 22nd, 1970. I actually can remember it. And as think we all know, it's grown to include a wide range of events and all over the world. So for this year's Earth Day, we at the USC Institute on Inequalities and Global Health are highlighting two areas that are central to our strategic priorities: sustainability, environmental awareness, and population aging. And so with life expectancy lengthening and the size of the older population growing in all regions of the world, the reality is we can now predict that most people on Earth are going to age on an unhealthy planet. And that is unless we dramatically shift course, which is why sustainability, healthy longevity are two pillars of our Institute's new 5-year strategic plan, which we've just adopted this month, that I look forward to sharing with everybody. So as with all of our work, we approach sustainability and healthy longevity through the lens of human rights. The kind of issues that we're focusing on are about how inequalities along the life course shape vulnerability to climate change, who is most vulnerable, but also what do we need to learn? Where is action needed to make public policy as responsive and as supportive as possible, particularly in this moment? And so to this end, we're honored to be co-hosting today's event with HelpAge USA, HelpAge International, organizations that are dedicated to amplifying the voices and agency of older adults in addressing issues like climate that affect their lives. And with that, let me turn it over to our Institute's Director of Policy Engagement, Professor Jonathan Cohen, to introduce our panelists and moderate this excellent session. Jonathan, over to you.
Thank you very much, Sophia. Good morning, good afternoon, good evening to everyone. I want to begin by also thanking our many colleagues at USC, Institute on Inequalities and Global Health, and HelpAge, who helped put together this event, especially Cindy Cox-Roman, who I'll introduce in a moment, Hari Krishna Nubanupudi, Alex Garvey, Jane Buchanan, Caitlin Chang, Linda Rivera, Caroline Diamond, Meg Goulding, and many more. As Sophia just reminded us, true to our commitment to human rights, we are going to begin today's session by hearing from two older adults about how they think about the impact of climate change in their community. And in a moment, I'll be turning it over to our co-sponsor, Cindy Cox-Roman, the president and CEO of HelpAge USA, to introduce you to them and facilitate that part of the program. After they are finished, we will zoom out and hear from Ritu Sadana from the World Health Organization about what the data say globally about the impact and indeed the unequal impact of climate change on older people. Ritu, we really look forward to being in conversation with you. And we will end today's session on a practical and hopeful note, hearing from Quinn Tran from HelpAge International about how older people's associations, or OPAs, are mobilizing their communities to address the unequal effects of climate change on older people. And I'm sure you will very much enjoy Quinn Tran's dynamic presentation. And after that, we should have a few minutes for Q&A. So I encourage you to use the Q&A function to enter a question at any time. So with that, it's my great pleasure to turn it over to Cindy Cox-Roman, President and CEO of HelpAge USA, also a graduate of the University of Southern California. We are going to put Cindy's full bio in the chat for you. Cindy, over to you.
Thank you so much. Thank you so much, Jonathan. As you said, we're starting small with a conversation with two of our Friendship Bench DC grandparents. At HelpAge USA, we decided to conduct a focus group among a group of older people residing in DC, connect with Friendship Bench to better understand their orientation to climate change, how aware they are of it, how familiar they are with it, personal relevance to their lives, and their orientation to action. When we did the focus group, the participants did not know the topic in advance, which was on purpose. But we asked them to describe what they see as the biggest challenges in the world. As you can imagine, there were quite a few. Climate change did not come up unprompted, but when we asked about it, there was a very rich, wide-ranging discussion. It was clearly an issue of great interest, great personal relevance, and motivation. Some of the things that came up top of mind were the frequency of extreme weather events and how that impacts their lives, more time indoors as a result of climate change and a disconnection to nature, environmental degradation leading to increased health risks such as skin cancer and water pollution, and a growing need for personal protective measures such as sunscreen and masks. So once again, these were just some of the things that came up. But I'd like to have everyone hear from two of our grandparents, as we call them, Friendship Bench DC grandparents, directly about what was discussed. So I'd like to introduce Dr. Tueri Marshall and Scarlett Small to join me. I think they're okay.
Yes, good
Good.
morning.
So,
Thank you
yeah,
so much, Cindy, for
great.
having us.
Yeah, thank you. So Scarlett, let me start with you. How does climate change impact your daily life in Washington, DC?
Yeah, well, we don't know what the weather's going to be like day to day for one. And so that is an impact. But I'm always concerned about when it's too sunny or too rainy, because I'm concerned about what's in the environment, that touches your skin or your body or your plants. Part of the sun is, we're more apt to types of cancer, whether benign or not. We're always concerned about our eyes, the cataract. We're concerned about the respiratory issues, because of all of the other things that are going on. But a lot of that has to do with trying to stay as safe as possible when you get older. Sometimes some of my friends have secondary health issues that are activated by the change in weather. Say now with the pollen that has been in the air, that has affected some people. And so as a result, people stay in and don't, like go to green spaces and commune and talk or have a cup of tea or anything like that, because we're inside, we're isolated for our safety.
Mm-hmm. Is that different than when you were growing up, Scarlett?
Absolutely.
Mm-hmm.
The kids stayed outside all the time. The adults were outside on the front porch, sharing. And it was a community thing where you got together, and it was a great thing to do. I mean, we all know the value of vitamin D rather, from the sun, but now we're thinking about, all of the airborne illnesses and things that are going around. And again, if you have any type of health issue, you're extra careful to expose yourselves to people as well as to the environment.
Mm-hmm, mm-hmm. Thank you. And Tueri, what about you? Any comments to add?
Yeah, so definitely the sense of isolation and inactivity is very real. Growing up in DC, we had 4 distinct seasons. You could count on them, just like you can count on breathing, right? We knew Christmas, we had there was a tendency that it might even snow, and a lot of times it did, and here it'll snow in the middle of spring. So that uncertainty, definitely impacts my coming and going. But I want to talk about the quality of my life and the predictability of it as I have moved forward through these wonderful 70 plus years, right? And because things shift so quickly, there's uncertainty and unpredictability, which does impact me and some of my peers psychologically, right? We're planning things, but we're not sure. There are family reunions coming up. Is there going to be a flood in Michigan where we're from, or fires or things like that? So there's a lot going on, mentally. There's also this sense of confidence. I'm the elder. I have this gray dumb wisdom, right? That really helps me to guide my family, my community, my neighbors. And so that self-esteem is kind of impacted a little bit as well, you know, as I move out. And then the very last thing, I'm used to having a very close relationship with nature, right? I know when, now I'm an urban girl, right? So I know when to put my plants on the front porch. And now I'm not sure. It's 80 today, as Jeff is experiencing, and I'm glad you're here. You know, but it might be 50 tomorrow, right? So that, and also when you're planting things for not only plants, you know, but also to eat, you don't know, you know, whether or not you can plant your vegetables now, you know, because of the uncertainty. So it does impact, you know, daily moving and then the quality of life.
Yeah, yeah. So it sounds like it's very interconnected in different aspects of your life, and yeah, also impacts your behavior and what you do. Scarlett, did you want to add anything based on what?
She's absolutely correct. You know, you can't just not be aware of what is going on in your environment. Again, I see people walking around with umbrellas all the time. Most of the time you have it, you don't need it, but the day you leave it at home is the day that it rained. So it happens. My kids listen to Alexa and ask her what the weather is in the morning, and they say today is a short day. But then by the evening the weather is cool and they need long pants. So again, we're just much more aware now of the weather rather than just, you know, assuming that spring means spring or fall means fall. So
Yeah.
awareness, we're absolutely aware of what's going on.
Yeah, yeah. Turi, in our discussion, you raised issues of the unequal impacts of climate on different communities. Can you talk about that?
So, yeah, sure. In DC, we have 8 distinct wards, but they're not just separated by boundaries. They're separated by economic levels, which could be in any of the wards, the level of education, the level of belief in access to resources, right? So some people have this agency, this belief that I can call City Hall or, you know, my city service, and I can have my trash picked up. I can live in a neighborhood, and this is very emotional. I can live in a neighborhood where my streets are clean, the air is clean, I can breathe, I can walk, there are clean spaces, you know, there are parks near me, and then there are other cement infest neighborhoods that have these high rises, you know, and you've got to really walk a long time before you can actually find, you know, a green place to walk. I walk with Girl Trek, which is a national organization that helps Black women who are disproportionately affected health-wise. And we know if we can walk 30 minutes a day for 5 days a week, that our life expectancy will increase by 10 years, right? Where to walk, you know? So in some of those neighborhoods, we don't have that access. We got to get in the car, which, you know, emits, you know, pollution and things like that. So
yeah.
So yeah, there's that. And then the very last thing, and I'm gonna be quiet on this.
Yeah.
This really is very, very important. When the city officials decide to make changes, and Scarlett and I have talked about this, to make changes to, you know, put streetcars in the middle of H Street or whatever, our family members are dislocated. We have been living in these neighborhoods forever. And you know, when you move an old person, it could be even into a beautiful nursing home or a wonderful, you know, relative, it impacts their life expectancy. So yeah, there are things that we have to have agency to understand that I can make a change by opening my mouth and advocating for change. But there are some people who, because I don't know, I'm just saying economics and just, you know, education, they just don't know how to advocate for themselves.
Yeah. I'm just watching our time. Scarlett, did you have anything to add about that, the unequal impacts?
Well, I just think that the declaration of eminent domain takes on a new meaning in different communities. And so some community ends up with the dumpster or the utility plant or some other thing like that. which also affects the quality of air or the quality of the soil in the neighborhood. And advocacy is really important, but some voices are not heard as much as others. And then the impact to the community suffers from that. You know, we had a community here called Berry Farm that was just razed. All the family living was gone, but a beautiful pool was put in. The people who used to live in that community that could have used the pool for exercise were moved from the community. Now people from outside of the community are coming to enjoy the pool without having been displaced. So all of those things are things that concern us as well, of how the neighborhood's changing, how communities changing, and then again, the impact of where does mama go now? And we're the mamas now, and so it may be in another high-rise building where you don't have access to the parks and things. And again, the quality of life is also impacted by your ability to exercise and feel safe, where you're living. And the density in the communities are changing. New structures are being changed. Sometimes it's mixed use communities. Those work pretty well, but sometimes they're not. It's just industry just comes in and do retail.
Yeah, definitely. Well, we have about 3 or 4 minutes left, and you talked about advocacy and action, and Tuere, do you think more could be done by older people to reduce the impacts of climate change? And if so, what would that look like? Oh, you're on mute.
First of all, listening to our young people. In my church, when we have events and we want to package up things and, take the trash out, so to speak, they're asking, where's the recycle bin, right? And so as elders, a lot of times, we have to learn how to recycle, reuse, and reduce, but our young people. So I think listening to the young people, and young people could be 40 years old, right? Not just teens, 40 and 50 years old.
Yeah.
So listening to them, but also teaching, those of us who are very alert to what an individual can do, have to, we're speaking up. We're telling people how to dispose properly of their incontinent products, right? Things like that. The plastics, we understand that, so far. So as Scarlett was saying, just first of all, reducing our footprint, number one, and then teaching others. And lastly, making sure that the powers to be don't ignore us, and I'm preaching to the choir now because I know you all are listening to our voices right now. But yeah, we are very much impacted.
Thank you, Tuere. Scarlett, any other thoughts about what older adults could do working intergenerationally or otherwise?
We could, where you dump your oils, your paints. I know we have a big thing with used clothes, making sure those go to places where they could be recycled instead of discarding so much. Repurpose some items that we can repurpose, There's so many trash dumps now that over the years emits gas. So we have to find a way to use more things that are biodegradable. I know we're down to a straw now, but we may get to bigger items that affect, our soil and everything.
Yeah.
And I do think that it's very important, even as something as your makeup. Read your makeup, read if there's aluminum in your deodorant. I mean, all of those things can impact us, but we do have to read the labels and then buy those products that are safe for us, and then the manufacturers will hopefully would do more to give us something that is healthy for our bodies as well.
Thank you. We have 1 more minute. Any closing comments on this
Well,
topic?
I want to say I'm happy to have my voice heard today. I mean, these are things that I've been talking about, and I'm very happy that there are other people who are looking at this particular issue. When you go through life sort of eating healthy from the garden to the table, and then you're in a city environment and you can't find the vegetables or you can't exercise, those things impact our life as well. We want to live long, but we want to live healthy, and we also want to be active. And I think the worst thing is to be alive and not know you are because of some kind of environmental chemical that has made your memory something differently. But I'm all for living longer, but I also want to live healthy and be active and be happy. So let us take care of our environment on Earth Day, and again, train others to also do the same thing, because the world that we live in now, we're passing on to our kids and their kids, and we want that world to be a healthy place for them to live.
Yes. Thank you, Tueri.
I think everybody can stay in their own lane. I'm not an environmentalist. I don't know the scientific piece of it, right? I'm gonna leave that to the scientists. But I do know that each one can do something. Each one teach one. Each one can do something. Stay in our lane and do something, right, to make this a better world. Thank you.
Fantastic. Well, thank you both so much. Really incredibly great to hear your voices and your thoughts on these topics. And I'll hand it back over to Jonathan with appreciation. Thank you.
Thank you, Cindy. Thank you, Scarlett. Thank you, Tuere, for being so generous with your time, your expertise. We acknowledge that this is an emotional issue. We acknowledge that climate action and human rights action begins at home. It begins in our communities. It begins in our neighborhoods. I'm sure many of you, along with me, were asking yourselves, listening to Scarlett and Tuere, how much of a global pattern is this? To what extent are the challenges and indeed the responses they articulated repeated and replicable in other parts of the world? And to help guide us through that important question, we're so fortunate to have Ritu Sadana from the World Health Organization, an expert in healthy aging, one of the architects of the United Nations Decade on Healthy Aging. So Ritu, if you could join me in the spotlight, I want to ask you a few questions. You've just benefited from that extraordinary set of testimonies. And the first thing I want to ask you is from the perspective of the global data, what does the data tell us about the range of health effects of climate change on older adults? But also, how does one even go about measuring that, considering climate change might be one of many factors contributing to health outcomes? Over to you.
Well, thank you, Jonathan. Also, just for me to be able to participate in this conversation. I have a few slides that I'd also like to share to respond to your questions. If we can go to the next slide. I think first, if we go to the next slide, first, I think what I'd like to do is just frame what do we mean that when we're looking at older adults and healthy aging. And I think that what Scarlett just mentioned in terms of living longer, healthier, and also to be active is very much the perspective that we hear from people around the world. And the way we've kind of thought about healthy aging is that it has three important components. One is your capacity, so like what's in your body and your mind. It's your physical and mental capacities that you can draw on. So we're not talking about disease, but you can move and you can think, and your mood and things like that. Like what makes you you and be able to think and be. Another important part, and I think that's what's really relevant to this conversation as well, it's the environment all around you. And that includes like the natural environment. It also includes the services, the systems, the policies, the attitudes, like including if people honor older persons or if they discriminate against them, and also what kind of support you have. It could be like relationships with other people, but it also could be like technologies you use. And then if you interact with your environment, so your mind and body interacting with the environment, then this enables you to do things. And we call that your abilities for being, for having well-being or quality of life. And these abilities are like ranging from everyday basic things A lot of them are like, the things that in the Universal Declaration of Human Rights, for those of you who know Article 25, about food, shelter, and medical care. But it's also about an ability to continue to learn, to get around where you want to go, to maintain relationships, to contribute to families and societies. So basically what I'm getting at is that when we look at the impacts of climate change on older adults, we're not just looking at biological impacts, or even disease impacts, but we're really looking at, can people still do what they want to do? Can they still, enjoy being in their neighborhood like Tweri just talked about? So I just wanted to frame it like that. So second, in order to think about this kind of more clearly, we've also thought, well, what are the pathways from climate hazards to the impacts on health? And how can we ensure that we can attribute this climate hazard to what we actually see in the way people live their lives? So I'd like to just show the next slide, where we've put together with colleagues, Matthew Prina and others, an overview where we say, look, there are structural determinants. There are also things that shape a person's social position. And this means ethnicity or occupation or education, gender, and how these interact so that you have opportunities, access to resources. And also it shapes your potential vulnerability or resilience to climate change. Then we actually consider a full range of hazards. Extreme temperatures is one. Excessive cold or heat, perhaps that's the best known, as the thermoregulatory abilities diminish with age for human beings, making older adults more susceptible to extreme temperatures. And also, we know that dehydration is particularly important when you don't have access to clean water. And this increases the incidence of acute kidney injury and renal failure. But there's also other things, not only the extreme heat. There's wildfires, droughts, floods, storms, sea level rise, climate-sensitive infections, and also changes in air quality. From around the world, we know that malaria and dengue and other vector diseases are increasing due to climate change, as are waterborne gastrointestinal infections, which not all, but many older people may be more kind of impacted by than younger people. I mean, I don't need to tell all of us about, recently what's happened in California, because we know the rate of wildfires increase the microscopic particles that are released in the air. And older people can have a greater impact, including greater increases in the incidence or worsening of asthma, chronic obstructive pulmonary disease or COPD, cancer, cardiovascular disease, and pneumonia. For example, from Australia, we have pretty good evidence showing that cardiovascular mortality rates increased during days when wildfires appeared. But then we have to consider how these hazards actually impact different exposure pathways, such as food and water insecurities. So like in many parts of the world, climate disasters and extreme weather events, kind of like what we saw a couple of years ago in Pakistan during flooding, this really alters crop yields, and many of those smaller farmers are actually rather older people, and so they have small plots of land, and it's really devastating because they're, as economists we say, their time horizon to rebuild is shorter, and I'll come back to that point later. And not only do you have decreased crops, but you also decrease the nutrient levels that are important for older persons, but also for younger persons alike. I can go on and on, but you can let me know if we should go to the next
No,
question.
thank you. It is remarkable, first of all, the resonance between this framework that WHO has developed and what we heard from Scarlett and Tuere, and the pathways by which climate change shapes opportunities for healthy longevity they seem infinite. Um, I can also imagine that those effects begin at a young age. They don't begin when you're older. They
That's
accumulate.
true.
And I wonder if you could talk a bit about what a life course approach reveals about the relationship between climate change and health in later life. How do those effects begin early and accumulate as we get older?
Yeah, actually, we've learned a lot from life course epidemiologists like Diana Koo on thinking through different models of how risks accumulate. It's really important to consider the timing of exposures, including during critical and sensitive periods, critical periods of development, and sensitive periods can be throughout a person's life course, and it's not only biologically determined, as well as kind of what is going on with exposures that interact. If I could just show the next slide. This is kind of a sciencey slide because it shows a couple of different models of risk accumulation. And what's kind of important is that we're trying to think, given that previous slide I showed with the model, then going a little bit deeper in understanding how these exposures either contribute to a change independently, or if they contribute as they increase several exposures or issues at the same time, or if a particular event triggers a more serious event as you either in a shorter time period or a longer time period. So this sort of trigger chain of risks can accentuate climate hazards. This could be starting from exposures that men and women have before they have a child, also exposures during fetal development, as well as children. And some of these exposures can also have a latent impact, meaning it's only known later on in life when you're older. And that's really why we need longitudinal studies so that we can understand what happens earlier in life that may then either be beneficial or cause harm in the future. So my first slide had shown, like I mentioned, potential pathways. But again, it's only through these longitudinal or life course studies that we can really understand how climate change related exposures influence health, given that there's a lot of complexity on both biological and social changes. So I have to say that many others who are working in this field think that our biggest research gap in life course epidemiology of climate change is really determining whether exposures are really important in those sensitive or critical development periods, or if they're really accumulating throughout the life course. And this would make a difference in what kind of strategies we could put in place to either prevent or mitigate potential harms. So I want to make this more concrete in the next slide, which really tries to show how we want to optimize people's health. So as I mentioned, and I think as we heard, healthy aging is about enhancing reserves as early as possible. It's also about delaying any potential declines in those mind-body aspects so that you can still continue to do what you want. But if you do have declines, we want to make sure that our environment is supportive. So even if you're not able to physically go where you want to go easily, you have a possibility because of support in your environment, to be able to move around is just one example. So what this slide shows is that exposures can increase vulnerabilities. Those are the arrows that go down, but they can also build strengths, and those are the arrows that go up. And this is going to be unique for every person from birth to older age. And if an older person experiences a major climate change hazard, the impact will be shaped by these overall life experiences, as well, of course, the immediate environment. And I think we saw the same in how older people very differently experienced the pandemic, or when we look at very specific situations in different countries like humanitarian crises.
I want to thank you so much. I want to ask you about something you said earlier, Ritu, about how social position influences this, because I think that gets at some of the inequalities within the framework that you're talking about. So you mentioned earlier that social position that could be related to income level, it could be related to race or gender or disability, contributes to the patterning of how these various exposures contribute directly or indirectly, positively or negatively, to opportunities for healthy longevity along the life course. Could you speak briefly, maybe elaborate a bit on the social position issues and some of the inequalities that creates?
Yes. So, I mean, we tend to think about models and studies, and then we actually try to have conversations to understand, are we really being able to reflect what is happening in the world so that we can support evidence and studies to enable people to understand why it's important to look at the different backgrounds of individuals. So my previous sort of slide showed one person. I'd like to just show the next slide, please. Because, when we're trying to synthesize evidence, we're not only trying to consider the hazard and the impact on the level of health, but also the distribution of health. And that's why social position, and given that each person has multiple facets, it's important to understand, as well as those wider determinants of health, precisely to document inequalities and then consider to what extent these are generated through unfair opportunities or exposures. You mentioned several characteristics: gender, education, occupation, ethnicity, and poverty have all been shown to be correlated in different ways in making people more vulnerable to climate hazards. Our research from around the world shows that older women living alone in rural areas without digital connectivity are a particularly susceptible group. And so what I wanted to show in this slide, if we can just click, so you'll see a bunch of circles come up. Caitlin, if you can click 1, 2, and 1, 2, again, if you can click. Okay, perfect. So if we look at 3 different individuals, we can see that in person A, they've experienced negative impacts during a critical period, either as an infant or as a developing fetus. It depends if they have a household or a community that has access to more resources to help mitigate those negative impacts. If we look at person B as an adult, he or she has built up physical and mental reserve capacity. And that's really important prior to having any particular hazard. And if we look at person C, an older person, they might have had support, yet after a particularly important climate hazard, they really have less time to benefit from mitigation or even adaptation interventions. Remember the farmer in Pakistan who's lost her land, where it's going to be very difficult to rebuild and actually see a return in her investments. So I think what we really need to understand is that there's not one particular approach, but you have to look at the specific location, the context, and the different types of social backgrounds and socioeconomic characteristics that people have, and understand and document then what are the potential impacts due to the climate hazard and how these vary.
Thank you. So, Ritu, I do have one more question for you about what the data tell us about interventions to address and perhaps interrupt some of the pathways that you've outlined. I would like, however, to turn it over to Quinn Tran first to describe a bit about how older persons associations are acting to address these pathways, and then come back to you just in the interest of time, if that's all right. So thank you very much for this. I think, very powerful to begin with the testimonies and then hear what the data have to say. And would like to now bring in Quinn Tran, who is a Older Persons Association advisor with HelpAge International, who's going to get very practical for us and share a bit about OPAs in general, a phenomenal civil society intervention that mobilized millions of older people around the world, and specifically how OPAs are working to address and mitigate some of these unequal health effects of climate change that Scarlett and Tueri and Ritu have discussed. Over to you, Quinn, and everyone's bio is in the chat.
Okay, thank you very much, Jonathan. My presentation today will be on older people responding to the unequal health effect of climate change in Asia. Next, please. My presentation will be in 5 parts. Part number 1 is population aging in Asia. Next. In 2024, 59% of the world's older people were in Asia. And by 2050, this percentage will increase to 63%, which will increase to 1.3 billion older people. By then, 1 in 4 in Asia will be an older person. Next. However, many countries in Asia still have limited resources to properly respond to and take advantage of population aging. So what are countries to do when the demand for service and support are large and growing, but the resources available are very limited? Next. Part 2 is Older People Association, or OPAs, in Asia, the evolution. Next. In the First World Assembly on Aging, held in 1982, more than 40 years ago, the meeting resolution recommended member countries to consider supporting the formation of OPAs to respond to the wide range need and aspiration of a rapidly aging world. Next. Since then, with ongoing input from older people, their communities, local partners, and the government, our basic project-focused OPA has evolved to the Advanced or the People's-Focused OPA, click, which, go back, which are inclusive of young and old, men and women, poor and non-poor. It is multifunctional, sustainable, and scalable. The result of this shift has been seeing higher and wider buy-in, greater sustainability, scalability, and affordability, and having wider and more lasting impact and reach. This has been our accumulation of 35 years working with OPAs throughout the world. Next. At country level, OPA may have different names, but they have similar purpose, which is to improve the well-being and inclusion of older people in their families, communities, and country development. As a result, Asia now has more than 1 million OPAs with hundreds of millions of members and is still rapidly growing. Next. Part 3 is climate change and health. Next. Climate change poses significant health risks to older people due to their vulnerability to extreme weather events, changing disease patterns, and environmental hazards. Here are some key climate health risks that we are seeing in the field. First is increased respiratory and cardiovascular diseases, mostly from poor air quality, due mostly to post-harvest open burn and burning of fossil fuel. Second is increased heat-related illnesses. Older people are more susceptible to heat-related illnesses, such as heat stroke and worsened chronic conditions in extreme heat. Third is increased infectious diseases. Rising temperatures and changing rain pattern can expand the range of vectors and waterborne diseases. And fourth is increased malnutrition. Climate change can affect food production, leading to higher prices and reduced availabilities. Next. This is a photo of Chiang Mai City located in northern Thailand. The top photo is taken during the rainy season. The bottom photo is taken during the 3-month dry season. As you can see, the air qualities are very different between the two seasons. Next. So, to take a closer look at the air quality problem in Thailand, first, 64% of Thailand population are small farmer, similar to many low and middle income countries. Next. And every year, they burn millions of tons of agricultural waste on open fields, releasing more than 200,000 tons of very harmful air pollution and emit close to 25 million tons of greenhouse gas. Next. And each year, poor air quality costs more than 17,000 hospital admissions, and more than 3,000 premature deaths. Next. Causing the country more than $5.3 billion in healthcare costs. Next. Part 4 is OPAs and climate change action. Next. So what does the OPA do? The OPAs are community-based organizations that are multifunctional. A typical OPAs in Asia has 8 to 10 core components, which are based on the top need of their community. Next, such as social and cultural. Can you go back? Food and income security. Third, healthy aging. Fourth, community-based care. Fifth, community-led development. 6, lifelong learning. 7, rights and entitlement. 8, resource mobilization. 9, disaster risk reduction. And 10, climate change. Due to time limit, today I will focus only on 3 that are very linked to climate change, which is climate change, healthy aging, and care. Next. With respect to climate change, OPA can take lead in both climate change mitigation and adaptation, such as providing awareness on climate change, promoting climate resilient food and income security, taking lead in community climate action, and promote eco-friendly power and energy production and usage. Next. With respect to health, OPA can address the health need of their community by promoting regular physical exercise and sport, provide health awareness, conduct regular health screening and checkup, and improve access to health insurance and medical referral. Next. With respect to care, the OPA can help address long-term care needs of the community by providing 4 very popular care services, such as social care, personal care, living support, and healthcare. In many countries, the OPAs are by far the largest care provider in the country, like in Thailand or in Vietnam. Next. First, so to make it easier to understand the important link between OPAs, climate change, and health, I would like to share some example on what OPAs are doing to promote the impact, reduce the impact of prolonged hazardous air qualities on older people and their community health. So next. So first, we look at outdoor air quality. OPA work with the community to encourage local farmers to switch to more environmentally friendly livelihood practice, which has the following environmental and health benefits, such as require no burning, no uses of pesticides, and no replanting, already regenerative. Next. Second, the OPA promote green and circular economies, which is an example. For example, the farmer grows the crop, they harvest what they need and take the waste and convert it into biochar in 1 or 2 hours. The biochar is then used to make soil enhancer. The soil enhancer is used to grow more crop. So with each growing cycle, they can have higher yield, use less water and fertilizer, reduce air pollution, remove large amount of CO2, and have healthier soil for hundreds of years. Next. Third, to reduce exposure to harmful air pollution, the OPA makes and distribute face masks, provide food delivery and errand service, and move their daily service activity online, especially during poor quality air quality days. Next. To reduce indoor pollution, air pollution, OPA promote the use of fuel efficient and low smoke stove. The result of this intervention has shown very positive results, such as large smoke reductions, improved air quality, and have many social, health, and economic benefits. Next. Second, OPA conduct awareness on PM 2.5, the do's and the don'ts, which are listed here. Next. Over the years, the OPA development model has become a popular development option for developing country with limited resources to promote more inclusive, appropriate, affordable, and sustainable development. What is built on top, which are built on top of the OPA will remain, will not just remain, but will continue to grow and develop. And next. With respect to national scale-up, the OPA is affordable for low and middle income countries to scale up nationally. For example, in the 10 ASEAN countries, if they invest just 0.16% of its 2024 GDP, it would be enough to establish 700,000 multifunctional and sustainable OPAs, or 1 OPA in every village or community in the region. Next. With respect to data is very important. So we developed a dashboard system where the OPA can then monitor and collect the data themselves, which relates to, for example, the costing of the OPAs, relating to the beneficiary, the income level, the health, livelihood, social, and also the fundraising effort of the OPAs. Next. We also have another dashboard to measure the impact level for seeing that people are happier, more solidarity, increased confidence, empowered, being healthier, and being wealthier. This is a tool that are designed for the OPA to manage themselves. Next.
I would like to share with you what we are doing to support older people and their older people association in 5 countries, namely India, Bangladesh, Cambodia, Thailand, and Vietnam on biochar awareness, production, and usage.
ภาวะของโลกปัจจุบันที่ร้อนขึ้นเกิดจากการปล่อยคาร์บอนของมนุษย์เพราะว่าถ่านไบโอชาร์จะเป็นตัวที่จะช่วยดูดซับคาร์บอนในอากาศ
বায়োসার পরিবেশ এবং জলবায়ু পরিবর্তনের জন্য খুবই ভালো। এটা আমার মতন নারীর জন্য খুব উপকারী। আমি রান্নার কাজে বায়োসার ব্যবহার করি কারণ পচে চলে বেশি তাপ ধোঁয়া ছাড়া রান্না করা যায়। এটা আমার সময় ও খরচ বাঁচায়।
Làm than sinh học rất dễ và nhanh, không tốn nhiều kinh phí. Than sinh học có lợi cho môi trường, vật nuôi và cải thiện đất bạc màu. Tôi mong rằng tổ chức 2, người cao tuổi các cấp, chính quyền các cấp nhân rộng mô hình này trên toàn quốc.
So next to the recommendation.
I think, Quinn, I'm afraid I'm gonna have to stop you there. Apologies for the technical issues. If it's possible to bring everybody back onto the screen, it'd be great to see Ritu and Scarlett and Tuere. Quinn, thanks so much for that presentation. In the couple of minutes we have left, I would actually like to ask Scarlett and Tuere, I'd like to end where we began and ask you, what was it like to hear about global data that attempts to capture exactly the kinds of experiences that you were describing, and to hear about what older people are doing in Asia to respond? Maybe just a word from each of you.
Well, I would say I feel validated in my personal concerns that through research, it has shown that there is an impact and that we have some common issues across the world that we can do together towards this problem to help make it better.
Thanks, Scarlett. Tuere, how about you?
Well, I have to get my tissue because I'm feeling that somebody cares. Somebody cares about us, and not only in an emotional kind of way, but in a scientific, data proven. Oh my goodness, a lot of the things that are going on, you know, in the Asian research is happening right here, right? So it is a global issue, and I think the solutions can be shared globally as well. But more important, it made me feel heard and seen, and that, you know, things are doing.
It is real. It is real and not imagined.
Yeah. And you all are doing what you can to help us continue to live. I got 20 more years plus to go. So let's go. Or 25.
Quinn, there were a couple of questions for you, if you can answer them in just like 30 seconds, about what are some of the challenges OPAs face? Do they face political pressure? Do people have trouble accessing them? Is there like a challenge you want to highlight for us?
Yes. I think that the biggest challenge is seeing older people as frail and needy. And that is the biggest challenge, not seeing older people as a resource. And if we're able to gather older people together and organize them, they will amaze you. They will just amaze you.
Ritu, would you like to say a final word for us? Thanks so much to you.
Just to say that, you know, we're in the midpoint of the UN Decade of Healthy Aging that you mentioned, and it's only with the engagement of older persons themselves that we can show that we're making a difference. And what we see from the data from around the world is that a lot of older people are engaged, but the biggest limiting factor is education. Yeah. So it's really important, and I think it's been discussed here, it's learning not just from younger people, but also sharing your knowledge as an older person with those around you, because we need to continue to increase the awareness and come up with innovative, small-scale solutions, as well as sort of the big science stuff. So thank you again for holding this event.
Thank you. Cindy Cox-Roman, any final word before the clock runs out?
Thank you. Yeah, I would just add, I think, to the interconnectedness, the global dimension, this is happening everywhere. I think older people want to have a role and do have a role, and excited just to see these dots being connected. So thank you.
Thank you. Well, look, on behalf of all of us at the USC Institute on Inequalities and Global Health, HelpAge USA, HelpAge International, Happy Earth Day. Can't think of a better way to market than this. Thank you all so much. Please, you can scan the QR code and learn more about our work. And just a huge thank you to all of our panelists today.
Thank you for
Thank you
saving
all.
space for us.
Thank you, Jonathan. Good seeing
Thank you.